I was instructed not to go to the hospital, which I found pretty weird, but we were all under lockdown. I was told by two physicians, absolutely do not go there. I started noticing there was some resistance. When I would go see a doctor that was related to my case, everything was about COVID. So much so that I was denied my medication. And I believe the exact words of the microbiologist in front of my mother was that I should take the vaccine, and if something should happen to me, I would be the trolley effect, and my death would be for the greater good of the community.
What if I told you that a simple insect bite could change your life irreversibly? Lyme disease, transmitted by infected tick, causes various types of infection and co-infection. Not only is the pain unimaginable, but obtaining care becomes extremely difficult because the United States Center for Disease Control, the CDC, has outdated diagnostic guidelines that leave many in the dark for not recognizing their illness. Lyme disease is often misunderstood by some specialists and is said to be one of the most controversial topics of modern medicine, because some think that the symptoms are imaginary and refer patients for a psychological test, while other doctors deflect to different specialists. Affected individuals are losing their lives and their livelihood as a result. Like Stephanie Lavoie, for instance, who is choosing medical assistant in dying maid to end her suffering. In this story, I'm bringing you David Ray, who used to work in lumbar industry and apparel, who is another victim of this failing healthcare system that refused to treat this controversial disease. This ongoing battle of navigating the healthcare system and finding adequate healthcare was a full-time job in itself. After more than 7 years of suffering, David still struggles with two well-known and common co-infections of Lyme disease: the parasitic infection called Babesia and Bartonella. Additionally, he is battling yet another parasite called Gnatostomiasis. After fighting for treatment, David managed to get treated for this parasite in Canada, but he had to go to the United States for help with Lyme disease and its related infection. David explained his lengthy process to us. Check it out.
Sadly, I suffer from a rare parasitic condition called nastoma. It's a parasite that only 5,000 people to date have been diagnosed with. It only affects 80 people in the eyes. I happen to be 81. And on top of that, within the last year, I was recently diagnosed with relapsing fever and Bartonella and Babesia, which are all within tick-borne illness and Lyme family. At first, when I knew what was wrong with me, but nobody else did, it was a long haul to get help. I did at one point get some help. My story was profiled on CTV at the beginning of the pandemic, and I had high hopes. I was tested for nastoma through NRCP at the MUHC, and the test came back positive, and they did give me a couple of courses of medication, but I kept getting sick. The people that were supposed to help me pretty much repeated the cycle of what had happened to me prior to getting diagnosed. They were more interested in disproving the disease, trying to attack my character, trying to insinuate that I was suffering from some form of delusional parasitosis, which I found odd because I was on television with one of very respectable scientists who I actually do respect. And the tests that I had are the only tests that you can have for that. And they were done at the two best laboratories through the parasitology department of that hospital. Like many Canadians, it seems that we have a plethora of researchers here, but not a bunch of proficient LLMDs that are practicing. I had gotten sent back into the system, and I've been on a waiting list for the doctor that's supposed to take over my case. It's been 11 months now. So I'm being cared for by an amazing internist in the United States.
Told me that when the pandemic did hit, we talk about the COVID-19 one, everything went worse for you.
So getting sick at the wrong time, yeah, definitely. So originally when I first became ill, even before getting the positive serology for the nastoma, I had passed a huge tapeworm, or well, I don't know what the species was, but it was a worm. You have the picture of it. Mm-hmm. I was instructed not to go to the hospital, which I found pretty weird, but we were all under lockdown. I was told by 2 physicians, absolutely do not go there. I started noticing there was some resistance. When I would go see a doctor that was related to my case, everything was about COVID. So much so that I was denied my medication. And I believe the exact words of the microbiologist in front of my mother was that I should take the vaccine, and if something should happen to me, I would be the trolley effect, and my death would be for the greater good of the community. Now that left me perplexed because I was there for a zoonotic issue, not a respiratory disease. And that attitude, although people weren't at their best and trying to maybe do their best for people, really set my life down a spiral of having to navigate a splintered system while being ill for a year and a half.
It costs you a lot of money. We saw it with like the test that you pay. We talk about multiple thousands of dollars. You saw also the lack of help here in Canada. At one point, did you think about maybe applying for MAID or ending your life?
So I got to be honest, no, because they could take everything they want from me, but they can't take my character. Now I get emotional when I talk about this because there's a young woman that was recently on the news that talked about MAID. There was a young woman that took her life because the system failed her. What doctors know but won't acknowledge is these things steal everything from you very slowly. And if you don't have the right support or the right medical attention, things can spiral out of control. I think it's horrible that we live in a country where we have a socialized healthcare system, where we have some great hospitals, and the people that are supposed to help you and protect you and get to a healthier place in life are the ones that are doing more damage. So me, no, but shame on the system that a young mother has to think about that, or a young, amazing, vibrant woman had to take her own life. I think what's going on here in Quebec with some of the regulatory boards and how medicine is practiced as a whole today has changed dramatically, and I think there's some major problems that need to be addressed.
Christmas is coming soon, and one way to encourage our journalism is to visit our boutique online at ribbonnewsstore.com. Not only you can treat yourself and your loved one, but you can encourage our journalism. So you can use my code Alexa10 for 10% off, and we deliver it where you are in this world. And go and check it out because you don't want to miss this.